80% of people needing ventilators in Nelson Mandela Bay public hospitals, and half of those entering casualty wards don't make it out alive. This comes as a second wave of COVID-19 hits the metro. Government says reckless behaviour has led to hospital beds being fully occupied. Ian says a VUM Tile visited a public hospital and filed this report.
At the moment, we are completely full. We do not have any oxygen points.
Yesterday, we had over 20 patients in a ward that should have had only 8.
The reality of casualty wards in Nelson Mandela Bay's public hospitals. But what's even more alarming is the mortality rate.
A COVID-19 patient is being resuscitated over here, then just meters away beyond those curtains, one patient has passed away.
80% of the people who go to ventilation in ICUs, we lose them. We lose half of the people who come to our wards.
One of the examples, we had a lady, we had no beds or stretchers available. She passed away in a wheelchair, sitting in amongst a crowd of people in the respiratory area. There was a 13-year-old boy lying in the bed next to her, and another lady lying in another bed right next to her, also watching it as it happened.
The ripple effect of COVID-19's resurgence in the Bay can be seen in the increasing numbers of staff who are testing positive or showing signs of fatigue.
I saw a message now in our work group. I think the whole nursing team in neonatal ICU has tested positive. So that's an entire nursing team in an ICU that has to now be quarantined for 10 days.
It's extremely difficult for staff to stay in PPE and also to keep motivated. There's a very high burden of patients who are passing away and who are suffering. And it's very difficult for some of our junior staff to carry that and to carry that burden. So we actually need fresh legs.
A shortage of oxygen only adds to the endless woes of public hospitals.
In total, if you count everything together, we only have 26 spaces on this floor. So we have to sometimes make quite difficult choices. In our A&E side, we've been able to split the oxygen points so that we can provide more oxygen to patients coming in.
While the Metro has put measures in place to mitigate the impact of the second wave of COVID-19, these are proving useless against the behavior of residents.
COVID is real. COVID is dangerous. COVID can kill. On a daily basis over the past week, we had in excess of 10 deaths per day. Day before yesterday, and this is only hospital deaths. Day before yesterday, 20 people died in our hospitals across the metro.
These deaths may happen in hospitals, but many don't happen in hospital beds.
Public hospitals are caught between a rock and a hard place. Even though beds are full, they can't turn patients away. The sad result is that many pass away in the corridors. VUM Tile, Port Elizabeth.